Hello my dear friends, my name is Mario. Welcome to marioLAB Health channel. In today's video I'm gonna surprise you a lot. I'm gonna give you specific information about calcium and how calcium improves or worsens your spine condition. Today's topic, in fact, might completely change the way you think about calcium. Is calcium good or bad for your spine? The answer is no, so simple. It's somewhere in the middle. We all know how important minerals and vitamins are for our overall health, especially for the bones and the spine. But what if I told you that too little or too much calcium can both be harmful? In my practice, I've seen very specific pattern, particularly in women in the age about 40 or 50 years old. Many of them taking calcium supplements daily, believing they are protecting themselves from osteoporosis. They also take multivitamins, which often include 400 to 600 milligrams of calcium. Then on top of that, they eating food rich in calcium like dairy products, leafy green and fortified foods. By the end of the day, their calcium intake sometimes exceeded 2000 milligrams per day. Yeah, that's right, my dear viewers, especially women, especially middle-aged and older women. Usually, many of you have taken calcium supplements and multivitamins, and you don't even read the label how much exactly is the perfect amount of calcium in your everyday food or everyday supplement. Here is the problem. Calcium is like spice in the cooking. Add too little to the dish, it's bland. Add too much and then it's ruined. Your body works the same way. When you take too much calcium, you can cause damage, especially to your spine and the joints. Studies show that excess calcium can trigger certain enzymes in the muscles that actually increase pain sensitivity. This means if you already suffer from the back pain, too much calcium can make it worse, even unbearable. And that's not all. High calcium level can lead to calcium deposits, also known as ossifications, which build up in the joint in the bones. And this is what exactly is happening to you if you take too much calcium each day and you don't even know about it. This is main mistake, especially if you take supplements and you don't take good care of your body and you don't think about what calcium and multivitamins you take each day. Now let's continue. Those calcium deposits can cause tremendous discomfort. At the most common place they build up is the joints, especially in the spine. Why spine? Because the spine is tightly packed area with nerves traveling through narrow canals between bones and the tissues. When calcium buildups in those places, it presses against the nerves. This pressure causes pain, stiffness and inflammation, and over time degenerative changes. Those changes are commonly known as bone spurs, or in medical terms degenerative joint disease. So even though you try to help your bones, you may actually be hurting them. And it is unbelievably important for you to remember how much calcium you need to take each day. On the other hand, too little calcium is equally dangerous. Without enough calcium, your bones become weak and brittle. Your spine begins to lose its structure and support. This leads to conditions like osteopenia and osteoporosis, where even minor movements can cause pain and a fracture. So what's the balance? Let me break down for you. Adults up to age 70 need about 1000 milligrams of calcium per day. After age of 70, you need around 1200 milligrams daily. And that's total calcium from food, water, and supplement combined. Going far beyond those limits day after day can be harmful. It's not about more, it's about enough, and of course the balance is the key. That's why you need to think about it, what food you eat, how much supplement you take each day, and you will need equal balance. Did you understand me? And remember, my dear viewers, 1000 to 1000 milligrams calcium per day is going to be perfect for you, and we must be in those safe sweet spots of calcium, and your spine will be much better. So how you manage your calcium intake right way? Here are my special 5 practical tips. First, know your daily intake. Read supplements label and be aware of how much calcium you're already getting from the food. Second, prepare food sources. Natural foods like sardines, sesame seeds, almonds, and leafy greens are better absorbed by your body than synthetic supplements. Avoid mega dosing. Don't exceed 500 to 600 milligrams of calcium in single dose. Your body can absorb more than that at once. Combine with magnesium and vitamin D is my 4th recommendation. Those nutrients help your body use calcium properly and prevent calcification. And 5th recommendation is going to be get your calcium level tested, especially if you're taking supplements regularly. Ask your doctor for the blood calcium takes, and this is all you need to remember, my dear viewers, and you will be perfect. And that's why calcium is unbelievably important, especially for elderly people, but we must know when enough is enough. Even better when it's perfect, as I said it in today's video. If you want to learn a lot more about something called vitamin D and how and why it's perfect for you and when it's not, please watch video right here. Thank you for following me, my dear viewers. See you in the next video. God bless you, God bless your family. Bye bye.